to get started here, and we've reached that hour. So thanks everyone for joining us today. Very happy to be here to talk about public health in Lancaster County. I want to start by thanking our sponsors, Rogers and Associates. They've been a longtime sponsor of the First Friday Forum, and we really appreciate their support. So thank you very much. Also, Millersville University and the Ware Center. We typically would be in the Ware Center if we were not in this time of COVID and being virtual with our presentations. So thanks to the Ware Center in Millersville as well. And so without further ado, I'd like to introduce our panelists today. Susan Baldrige is the Executive Director of the Partnership for Public Health. So we thank her for being here. Dr. Brian Barnhart is the Director of the IU13. And Dr. Jeffrey Martin from Penn Medicine. He is the chair of the Department of Family and Community Medicine at Penn Medicine. So thank you three so much for being here. We really appreciate it.
Pleasure to be here.
Great. And before I send the presentation to Susan and Brian and Jeff, I'd like to remind you all that on the bottom of the screen, there's a question and answer function. Feel free to submit a question during this time. We will not get to it until the end, but if you like a question that somebody else has posted, you can hit the thumbs up button, and the questions that have the most votes at the end will be addressed first. So feel free to use that. There's also the chat function, which I'll be checking as well, but submit questions through the question and answer function. And without, I'll stop talking here and let you all take over. So thanks so much. Go ahead, Susan.
Thank you. And thanks to everybody that is tuning into this presentation. We really think it's an honor to present to the Hourglass Foundation and to just tell our story about public health and how we're doing in Lancaster County. I'm the executive director of an organization that decided we needed some public health in Lancaster County when the county commissioners turned it down 10 years ago. We've been standing in the stead of a public health department without the power, the authority, or the funding. So that's not necessarily an easy job to do, and to still continue to work for public health. Public health is simply trying to ensure the best health and safety of our community. And sometimes we don't realize how good we could be because we've never had a public health department. Now, this came to a very sharp point during the COVID pandemic. We were underprepared and scrambling. I'm sure lots of communities were. But municipality or counties with public health departments were already like 10 steps away ahead of us in March and April. There's a little slide I want you to look at about comparing our counties to other counties and what they were able to do during COVID because they had public health departments. And you can see by our population, we're kind of in the middle of the other counties with health departments. There's also some additional municipalities, but they were able to do contact tracing right away. They were able to stockpile PPE. They had access to county health data. They had 24-hour COVID hotlines. They could coordinate all the location in a central area. They had the ability to analyze the data and map out the cases for the officials and the leaders in healthcare. So they really have an advantage. The biggest reason municipalities and counties with public health departments have the advantage when it comes to healthcare is they have access to something called PA-NEDS, and you may have heard of this, but it's basically the Pennsylvania version of the electronic medical record. That is not given out by anybody, by our state, to any authority except a local a local public health authority. And since we don't have that, you could probably take this down. I don't know, well, unless people want to keep looking at it, but unless you have that, you're not going to get that data. And for good reason. Do we want our personal health data just to be given out across the state to counties that want it? I don't think any of us want that. So there's a really good reason for the state to not give out that information. But there's also really good reason for us to have it. With that information on our health in the hands of a qualified person that knows how to analyze that data, we can make our community healthier and safer. And I'm going to use one example outside of COVID is something that's really frustrated us in the work we do, is we concentrate a lot on childhood lead poisoning. And the way it stands right now, we don't find out that there's danger to children from lead poisoning until they've already been poisoned. And it's irreversible damage to their nervous system and to their brain that public schools will have to deal with. Sometimes our whole society has to deal with, because children who are lead poisoned have a higher incidence of incarceration later in life. So we are really flying blind as far as trying to determine areas and dangers of lead to children in Lancaster County. And we are poisoning our children at a rate that's 3 times as high as happened in Flint, Michigan. We are also not testing very well. There's no one coordinating all of that kind of initiatives in Lancaster County. So there's lots of reasons for a public health department, both for education, for our citizenry, for our economics, and I can go into a little bit more of that later. But our organization, the Partnership for Public Health, has been working on a model for public health that is very efficient, not bureaucratic, but would still offer the same kind of data access and analysis that we would need to make good decisions. So I think it's time to just open it up to Dr. Jeffrey Martin, who's been on the front lines during COVID and has really been working on a lot of these public health issues behind the scenes, so to speak. He doesn't get any publicity, but he has a firsthand knowledge of what it's like. So I think this might be the time for him to present.
Thanks, Susan. Yeah, I don't want any publicity. As you may have known, public health leaders around the country have not necessarily fared well, and actually some have had death threats and other things against them during the COVID pandemic. So what I'd like to do is talk to you a little bit about what the Partnership for Public Health envisions as the type of public health that we would have here in Lancaster County. And so I'll walk through that a little bit and then pass this off to Brian Barnhart. We'll talk more specifically about public health and its relationship to IU13 and education in general. So let me see, I need to get screen sharing, it looks like. Yep, that works. Okay, so hopefully this will work out. Do you guys see PowerPoint on there? Yep, okay. So what we're looking at is something that we have called public health, well, not us, but people around the country have called public health 3.0. So if you think of the big wins that we had in public health when we got water and sewage to be separated and they weren't flowing into each other's pipes, when we started to understand food safety and we started to understand that vaccinations were very important in preventing disease, that's really kind of the first realm of public health. Then we moved into, in the 80s, into a public health, what people call 2.0, which looked at a lot of clinical services. It looked at high-risk groups, people with HIV, providing tuberculosis treatment, for example, which was really the focus around public health in the 80s and 90s. And now we're moving, many of us think, into a phase of public health 3.0. And the way I want you to think about this is that health systems have done rather amazing leaps in their ability to model disease and to introduce innovation to populations at large. And so Public Health 3.0 is really a way of thinking about public health, not from a system or a department or a group that is sort of separated from everything else, but it really incorporates all the good work that communities have done, that health systems have done, especially in the last 10 years, I think, as we now have electronic medical records, we're able to model quite nicely disease states where people live, what risks they might have, and our ability to do that has gone up tremendously over the past decade. So I like to always say this, that I think not having a public health department in Lancaster County has been a blessing and a curse. In some ways, the curse is, yes, we don't have the full data set that Susan mentioned. We don't have public health authority. But what has happened is that many in our community have stepped into the public health space to try to fill the gap. We have active health systems. We have active community members. I've been overly impressed once again at our county's ability to step up during times of crisis, and certainly we've seen that during COVID. So, so it's not that we don't do public health right now. It's just that we don't have the designation of having a county health department. I think that health systems and communities, like I said, have stepped up in a way that was really inconceivable when the public health regulations from the state were introduced. And you may know that those regulations have not been updated since they were first legislated in 1950. So the understanding of public health is really stuck in this public health 1.0 phase that we had. And that's really how the infrastructure around the state in the few areas that do have municipal public health authority have organized themselves. However, I would put out there that there is so much more activity now that can be called public health, even in counties that do not have public health authority. But we lack two really important pieces, and Susan mentioned these. The first is a full data set. So we are still unable, even though the health system here at Lancaster General has maybe 60 or 70% of data coming in. We do about 60 to 70% of all the COVID tests, so we can model that. We still don't have all the tests that are done within the county. And so the county can, or the state can report out their metrics, but we're not able to really model that complete data set. The other piece that we don't have, and I think this is very important, is public health authority that could intervene through municipalities to mitigate public health concerns. And so, as Susan mentioned, I mean, on a health system level, we can't do that. We can't share people's individual data, obviously, with anyone, with individuals or with municipalities. We can share data that doesn't identify anybody, and that is, pretty specific, maybe down to zip code or census tract, but we don't really have the authority to push out any other data that we have. We can certainly model it internally as a way to take a better care of our patients, but there are issues related to public health that go way beyond what health systems can do, and so I'll talk about that. So what are some of the fundamentals for Public Health 3.0? The first is having a chief health strategist. This may have been in the past someone who would have been a medical director of a public health department, but it's really more than that. It's somebody that can work with all the relevant partners that are doing public health to help drive initiatives that look and address at what drives a lot of the problems we see related to health, and those are social determinant of health issues. And I would add that this should be a person that's really disconnected from partisan or political influence. I think one of the learnings here with COVID is that we have lost a lot of public health messages in political or partisan rancor. And even now, when we're seeing record cases on a daily basis for COVID, there still continues to be messaging that's come out on a political or partisan basis that I think is not helpful. The second fundamental for Public Health 3.0 is really to think about how do you work collaboratively across sectors. There should be shared funding, so this isn't something that just is supported by the state and they give you money to do public health. There should be shared services. So it's not the public health department's job to provide services, and certainly we don't need a public health department to provide clinical services here in Lancaster because we have excellent clinical services. And I would also say that the governance should be shared as well. So the people that are doing the work should also have a say in what the work that needs to be done and the governance of that work. All this leads to collective action, or to use a phrase that most of us are familiar with now, collective impact, when United Way put out their grants. I think a Public Health 3.0 provides people with locally, timely, reliable, granular data that is sub-county, certainly, but even lower than that, and actionable data that drives initiatives, and also to monitor the impact of those initiatives. So for instance, in Lancaster County, we do not have data related to COVID cases that can be driven down to the school district level. Now, wouldn't that be nice to have? Wouldn't it be great if Columbia knew what their case counts were versus, say, Garden Spot or Elanco or Warwick? Because, even though we have full county data and we're given the numbers, we can't piece that out to say, well, what's happening in this part of the county? What's happening in that part of the county? And we have unique high-risk locations in our county. We have population centers that have higher density. We have a lot of nursing homes. School districts are not the only high-risk places. And if we had the ability to get that more granular data, we could start intervening, I think, on a level that we can't right now. Public health funding, again, should be through multiple sources. Everybody should have skin in the game. Those that are doing the work and those that are looking at the work or providing funding for the work, it should come from multiple places: grants, state funding, health systems. And so that kind of keeps this public health vibrant. And then finally, I think Public Health 3.0 should really have community oversight. There should be a board to help drive initiatives. The board should be well represented of people of Lancaster County. I think there should be an eye to health equity in the county. And again, targeting these social determinants of health that we know drive so much disease. And so I think that's a great way to think about having it not be political or partisan. So it's a community board, just like a lot of the other community boards that we have for different initiatives around the county. The health gap should be driven by social determinants of health. Life expectancy in our country right now is not really determined by how you live, but where you live. There are communities, sometimes only a mile apart, where the life expectancy in one community is around 80, and you go a mile or 2 miles over to another community, and the life expectancy in that community is 60. So we have this huge disparity. And it's important to model that, understand why it's happening. A lot of it is driven by socioeconomic distress, poverty, poor housing, poor transportation, poor medical care. But by and large, a lot of this is related to just these social determinant issues that we need to get a handle on. I think public health needs to be moving that way. We know now that probably 60% of all disease and premature deaths are driven by these social determinant of health issues. So we can certainly treat people once they have disorders and issues, and we do that obviously on a health system side. But if we just focus purely on clinical medicine, we're not going to be able to look at these other issues that are, essentially non-clinical to help prevent death and keep people healthy in our community. So really the idea is to shift public health upstream. So traditional clinical care is kind of solidly where we're at. We try to do clinical prevention, obviously, but it's usually on an individual basis. And as we move sort of upstream to a kind of a 3.0 public health issue infrastructure, we're thinking more of how does this impact not just individuals but community-wide. So what are the pieces that we can put into place on a community level to help prevent obesity, diabetes, hypertension, smoking. You can go on and pick whatever issue you want to be looking at. But obviously there's going to be crossover there because health systems have moved much more into a population health space. And I would use public health and population health sometimes interchangeably in this space. So the idea is to prevent not only on an individual family level, but to try to think about how do you shift upstream and prevent issues, diseases, disorders on a community level. So I like to think of it as really inverting the pyramid. So usually when we talk about healthcare, we sort of put healthcare at the base of the pyramid, that this is sort of where things kind of flow down to. Then we start to treat people. We have hospitals, we have primary care providers. And I'd like to think of this sort of in an inverted fashion. And so instead of putting clinical services and those kinds of things at the bottom of the pyramid, I really think what we need to think about are the drivers of the issues that people end up in the clinical setting. And those are the social determinants of health. So the idea is really to think beyond just treating disease, thinking about how do you prevent it, how do you work on the social determinant of health issues that drive utilization, that drive disease. And again, you can pick out whatever particular issue you think is germane. The interesting thing is that these are determined by the local community. Lancaster doesn't necessarily have the same issues that York County has, or the same issues that Allegheny County has. We have some of the similar issues, but they're not all the same. And so it's incumbent upon that community to sort of do a deep dive, again, having the full data set to be able to model it, to understand what are the particular issues that are driving healthcare needs within that community. And so you see this public health evolution. So again, public health 1.0 was really these broad-based public health measures like sanitation and vaccination. Public health 2.0, where there was an infrastructure that was now developed, and so we decided we need to move this to local areas so that we could manage problems locally. To now 3.0, and this is the idea of trying to engage multiple sectors, community partners, and the idea of collective impact, really with a focus on health equity and improving the social determinants of health. And frankly, we've already gone down this road. Again, this is the blessing part of not having had a public health department starting in the 1950s in Lancaster County. We have community-wide innovation. I'm sorry, I only mentioned a few up here. I know there's many more, so if anybody is a part of ones that I'm not mentioning, don't take offense. I just couldn't list everything that's going on in Lancaster, and there's many great things. We have Live Well, the Lancaster Lead Coalition, as Susan mentioned, several opioid coalitions. Lanco My Home, which interestingly is connected to our health system, and we're starting to think about innovative ways how homelessness affects health, how we can do a better job at taking care of homeless folks. The United Way, obviously, and many others. I will just say that COVID-19, the response from this community has been, frankly, pretty amazing. From the county level, providing funding to the schools, to IU13, to the health system, to everybody else that has kind of come together. We are one of only 2 counties in the entire Commonwealth without a municipal health department that have had a county-wide unified approach. We've leveraged our relationships with Department of Health. We've leveraged relationships with other health systems. I think this is the first time, at least in my 25 years, that health systems are playing nicely together. So we've done a lot. I mean, it's pretty amazing. And yet we don't have the full data set, nor do we have the public health authority to act on all the good work that we're doing. So I only see that as kind of the cherry on top. If we had that, I think we would be able to provide much more granular information to school districts, to communities. I think we would be able to model even better with messaging to certain places that are high risk. And I think we would be even in a better state than we are now. So I really think our county is poised to meet shared goals. Having the full data set, it can be modeled more granularly and specifically for Lancaster. Public health authority allows you to act. It allows you to act more timely, more holistically, and more appropriately to the issues that are going on the local level. And having that in the environment that we find ourselves in Lancaster County, with all the good work that's everybody that everyone has been doing, I think would just be a tremendous benefit to us all. So I will stop there and pass it over to Brian. Thank you.
Hey, thanks, Dr. Martin. Hourglass, it's always a privilege to be with each of you and this group. I count it a privilege to be here today. I want to start first off and let you know I don't have a formal presentation to give, but I want to speak from the heart a little bit about what our schools have experienced over the recent, pandemic to now. But before I begin, I'd be remiss if I didn't acknowledge Dr. Martin and the work that he and his colleagues have done on behalf of our superintendents and our schools to help us in light of the fact that we don't have a department. We couldn't be where we are without the likes of Dr. Martin and his colleagues. And, my hat's off also to the county commissioners. They approached us and brought CARES dollars, important funds to help purchase PPE and take care of some of those expenditures to help us fill the gap. But nonetheless, without a county health department, I do believe in many cases we've been working harder, not smarter, than our colleagues across the Commonwealth where there are departments. I'll give you some four instances. Right now, as we have need to consult with the Department of Health, because we do, superintendents are all licensed, commissioned officers of the state with a responsibility to follow the lead of the governor and his cabinets. We depend heavily ultimately on recommendations from the Department of Health. And here's our experience. When we make a phone call up there early on in the pandemic, it was kind of like a Forrest Gump experience, right? Life's like a box of chocolates. We'd call up and you just didn't know who you were going to get and the quality of the response that you would get. Because without fully fledged Department of Health folks assigned to Lancaster, we were just as likely to hear from someone from Erie as we were from someone from Scranton or elsewhere within the Commonwealth. It was kind of a fill-in based upon demand. And midway through the pandemic, the Department of Education and Health combined to create what's called the Rapid Response Center and established a hotline. And again, while that was okay, the Rapid Response Center, at least for the most part, has been a not so rapid response center at times. And the quality of the person responding was kind of up for the rolling of the dice in terms of who was available to respond at a certain time. And so, we've got 16 school districts in Lancaster County, really getting 16 different sets of advice. We have relationships with local school docs that have never really been premised to work in the pandemic kind of fashion. So school long since has not just been academics, right? Public school, we might need to find a new name for it because it's all those things that lead up to creating the environment and conditions for learning now, the child's nutrition, the child's mental health, now the physical well-being. And we don't traditionally have the expertise from a medical perspective that we would like. So when I look around, I've been the president of the state I use recently, and I see my colleagues where there are Department of Healths. And I have to tell you, much of the information early in the pandemic that I could bring back to our school leaders was from those counties that had local departments of health. I'll give you Bucks County, for instance. A good colleague of mine is the executive director up there. And from March 11th on, from the day this thing went viral, no pun intended, the local Department of Health leader has been in every weekly superintendent meeting there. The superintendents know the executive on a first name basis. They have access to his cell number. And the questions don't go to a hotline. They don't go to the luck of the draw who might respond. They don't get two different responses of different indications. They go right to their local person with whom they have a strong relationship, and their answers are done. They're working smarter, right, in this, and getting the resources that we need. I think if there's any one thing, that's what we're missing in the local level. I've heard our commissioners and our elected officials say, frankly, in the middle of the pandemic, that they didn't like having decisions being made from the state level over Lancaster County. Well, sure, I think we're capable of it, and as Dr. Martin said, we've demonstrated our ability to have a countywide response, but all the more reason then we should have a local coordinating Department of Health. With LG Penn used to be the sole provider in the area, but now we've got UPMC showing its front. We have Penn State, coming down. We've got WellSpan. We've got a number of entities, and it's only growing larger. And I think we need some greater coordination as the 22 districts serving families across our county that have people involved in every medical system. And so it's just an appeal on our part to say, give us some coordination. I mean, I started off thanking Jeff Martin, but we're not his only entity in town. I mean, the schools aren't the only thing that they have to do out of the goodness of their heart. They've been working with us. We need someone who, has that greater responsibility to serve the districts, and it's also about equity. Obviously, we've got people in some of our school districts that have some greater wealth. We have more capacity to make the calls and to work with departments of health than we do in other school districts. And by the zip code that you live in, you might have greater access to get the kind of faster response to questions than some others. And a Department of Health, I think, could bring equity to that. The one thing about Bucks, all 13 of their school districts have the same service now. They all know, have the same access and know how to get it. And that's just one county. It's the same in some of the others. So we'd love to see that go. We were advocate at IU 13 10 years ago, asking the commissioners to consider this. And I can only think how better we would have responded. Not that our county hasn't responded well, but how much better and more efficient we could have responded to this pandemic had we had a Department of Health in place, despite some of the curses that we saw could occur with it. But I think the blessings of having a county health department are real, and Lancaster County is too great of a place to be a second-class county in terms of its healthcare ability and advisement to our schools and to our families. Lastly, I'll say this. We often think of the public schools of Lancaster County as being school-age children, but it's so much more. It's so much more. Our birth to 5-year preschool is a significant population that needs that same kind of care and advice and treatment, and could glean from guidance from a Department of Health. And as the per capita, one of the friendliest places in the nation for immigrants and refugees and helping people transition, healthcare is a vital need to them. And the fact that we could bring some greater coordination to that stands to improve really the life and economy for all of us in the county as we rally those folks around and keeping them healthy. So we see it as just wins on every front, and think it would be a great benefit to our schools, to our communities, to our families.
Fantastic. This is all really great information about what public health is, and then also what Public Health 3.0 could be here in Lancaster County. Susan, do you have additional presentation here, or should I get into some of my questions?
I don't want to stop you from getting in your questions, but I mean, while the Jeff and Brian were talking, I was thinking of some more points that I wanted to make, and I could probably talk way too long on this, but we will be Delaware County and not Delaware County, Delaware County, and Chester County and Bucks County and Philadelphia County, Allegheny County. They all established health departments many, many years ago. But we will now as of January, be the largest county in Pennsylvania without a public health department. And we'll be one of the largest in the country without a public health department. And I just strongly feel that we have a unique county, like Jeff said. We need to address our specific needs of our county. We have a very unique county, and also in our congregate settings. I can't tell you the confusion and lack of guidance that might have helped in a couple different situations in Lancaster County, our long-term care settings and among our plain sect populations, both of which were really hit hard during COVID and might be again with another outbreak. We're fortunate enough to have some federal money right now for COVID, but if we have a measles outbreak, cholera, name anything, we're not going to get that federal response. We're going to be on our own. And the biggest thing we need right now is coordination. Somebody looking at the whole county, not just pieces of the county. We need to have that all combined. As taxpayers, we're all paying taxes toward other counties' health departments. And the money that is coming through the federal government and through the state government for public health, we're getting none of that. Just recently, Pennsylvania got $90 million for public health departments, and we got zero of that. So we are missing out on that. And then there's organizations that can't apply for specific grants because they need to partner with a local health department. So money-wise, we're missing out on a lot. And I just want to make one quick point about business and health, and then we'll get on to the questions, is that 95% of health insurance coverage in this country is through employers. They're paying that. They have a stake in a healthy workforce and a healthy community. 75% of the healthcare costs are going to diseases like Jeff Martin just said that can be prevented. Higher productivity, less absenteeism, a healthier community, healthier families. That is something that we could be on the track for with the public health department. So I could make about 20 more points, but right now we have been in talks with the county commissioners. We're not getting a lot of positive response, but they're also saying we haven't heard from people who want a public health department. So this might be a way to start the conversation about just that if you do think that we need to explore this issue, maybe now's the time to contact your county commissioners. Thank you
for those. Yes. Yeah, that's great. So if you have a question, submit it down in the question answer function. That's how we'll get to feedback from you all. And one of the benefits to hosting is I get to go first with my questions. And I'll ask, part of your presentation, Dr. Martin, included a discussion about how we in Lancaster have been adopting a lot of these public health activities and policies and operating in that space here in Lancaster County already. How do we ensure, if Public Health 3.0 is enacted and we have a department here, how do we ensure that we aren't having a redundancy of services that's offered by the Public Health Department and already in existence here in Lancaster County?
Yeah, I mean, I think that's really important. I mean, the last thing we want to do is supplant the good work or to duplicate the good work. For instance, initially public health departments provided a lot of clinical services. So they had maternal child health clinics. They had clinics for HIV. And, we don't need that. We have good services. The primary care base here, unlike a lot of other counties, is quite excellent, and we've decentralized a lot of our care for these things. Taking care of somebody with opioids with medically assisted therapy, we don't have to send them to the medically assisted therapy clinic. They can go to their family doctor and get it. Oh, by the way, they might have diabetes and congestive heart failure. You could treat that too. So I think it's really important not to have public health for the sake of public health. If you are, going to squelch the good work that's being done or duplicate. And I think that's our argument. That's our argument to the state, is to say, you know what? These regulations that were initially put forward were written in 1950. It has no basis with what's happening in reality. And we'd like to share with you a way we think we can do public health, with the addition of having the public health full database and authority, so that, you know, the schools can act on it, IU13 can act on it, that other places around here can act on it. So, you know, there's no point of having duplication, but we need, that's why you need sort of a board, people to look at it to make sure, you know, what is redundant. Let's not go down that path. We don't need to build a new infrastructure just for the sake of having a new infrastructure. I think it's going to just take all of us, you know, thinking smart about it.
Right. And a part of that too is looking at the cost of a public health department. And folks, one of the arguments potentially against a public health department is that it's another layer of government, of your bureaucracy, and it will cost money to the taxpayers. What's your response to that? Is that an accurate look at this, or how will this public health department be funded?
So again, I mean, and Susan, you probably can answer better than I can, but we're paying for other counties' public health departments right now. The tax dollars that are allocated to public health go to the state. They divvy that up among the available, the number of municipalities, and they pass it off. None of that comes back to Lancaster. So we're paying right now for health departments in other counties. So that's the first point I think people need to realize. The second point is, again, a lot of grants, especially from the federal government, HHS, other places, don't flow unless you have public health authority to collect that, to take it in. And so we're missing out on that. The third part is we already fund in our community a lot of these activities. So we're not talking about necessarily needing additional funding. Now, there are pieces that we would need to figure out in terms of environmental public health issues, water, air, some of those other pieces, that how would we provide those services. But we're way down the path of already doing a lot of public health. And so you have to take out the understanding that somehow we're not doing anything and you have to establish a whole bureaucracy in order to help all that happen. The bureaucracy is minimal. It's somebody that can have line of sight on the full data set, help make decisions, be responsive to communities or a school district that says, hey, tell me what our numbers are. I need to know over the next week because I'm going to be meeting with my school board and they want to know. The county rate's not going to cut it. We need the full, you know, just the people in my district. So, you know, I think that's how we envision it. Susan, you might have more you want to add to that.
So one of the biggest impediment to starting a public health department is the upfront money. And that's why a lot of smaller counties have not really instigated one, even though that they really want one. It's kind of made a little bit difficult. I think Lancaster, we're in a different situation. We could come up with some upfront money to get started, and then we get reimbursed from the state for everybody, man, woman, and child that lives in Lancaster County. So most of all the costs are actually covered. And other counties are making money out of some of the services like inspections, things like that they perform. It's hard to say exactly what the budget might be because we're looking at a sort of a new model, a hybrid model where it's going to be very slimmed down, but it's probably going to be cents, a matter of cents for every, you know, person living in Lancaster County to provide the upfront money for the county. And then it sort of depends on how expansive we want to make it. We're envisioning a very slim one, a very cost-effective one that wouldn't make an impact on our taxpayers, but would give us the opportunity to get a lot of funding flowing through us.
So what Susan, maybe you could expand on this a little bit. What are the next steps if in establishing a public health department here in Lancaster County?
Well, the first step would be to get a certificate of approval from the Department of Health, the State Department of Health. So we would need the county commissioners to pursue a certificate of approval. Now, that doesn't mean that they're going to go through with it, just means they're going to investigate it. And I think that would be the perfect vehicle and timing to do that, to see if the state can look at this sort of new model. We would get services. We would have a public health authority. We had some lukewarm support initially from the commissioners to take a look at it, but they seem to have backed off of that. And like I said before, they're looking for the citizens of Lancaster County to make their voices heard. And I think this is an excellent time to do that. I think we need to at least take that first step and investigate where the 3.0 model can fit in for us.
And is there a worry that the state might not approve of a 3.0 model here in Lancaster, or is that something that's been done in other places? I think, was it Delaware County? Are they doing a 3.0 model?
Yes, they're planning they're investigating a 3.0 model. Actually, that's where we got the name for it, because this is an interesting fact. 10 years ago, Hilda Shirk was the person in my position that was pushing for a public health department. And her design of one and her initiative was exactly 3.0. It just didn't have that name. And they got a certificate of approval from the state. So I think the state is open to new ways of looking at it. I don't think that should be the argument against investigation of how we can make this work.
Right.
Although you might hear that, but that shouldn't stop us.
Great.
Mm-hmm.
So at least my understanding is that part of this process is there's a study that's done in terms of a kind of a feasibility study of what this looks like here. And are we able to use CARES money for that in the county?
We would be able to do anything with the CARES money. Of course, December 31st is a hard stop on that, at least for right now. Things are a little up in flux at the moment, but we certainly, as an organization, we gave a very cost-effective channel for the commissioners to do a feasibility study, about half of what they're trying to do in York. The city of York has a public health department. Now the county's looking to expand into the county. So those are just avenues that we could pursue and see how what the reaction is from the State Department of Health. But I think it would be positive.
Great. And I think that could be the quote, the slogan for the year: everything's up in flux for 2020.
That is true.
I think
that is true.
So with the last 10 minutes we have, I'd like to get to some questions from folks in the audience. So Sydney Marlin, Hourglass board member and founding father, he said, many don't realize that the IU includes Lebanon County. How do you see a health department playing out there? This is for Brian, I would guess.
Well, certainly everything that we do with the IU, we do with an eye on Lebanon as well. So I don't know if the county department, if there are departments that could span multiple counties or not. I mean, we see all of our medical professionals, LGH and WellSpan, moving across county lines as well. So I'd be certainly a big advocate, as I always am, to expand it to include them. But, you know, our superintendents are working, they're doing a really yeoman's job with little guidance that they do have coming out of there. And they're often playing this role of politics. That was the question earlier. You know, it's easy to dismiss the medical advice coming from Department of Health out of Harrisburg because they're so far away. With boards who might want to rule a different way, and it has all become so politicized. It's harder to refute the medical advice when it's right here where you live and work, and it's coming right. So yet another reason why I think it's so important. But we would look to try and find ways to involve Lebanon. But even if the county health department didn't involve Lebanon, I think they would benefit just because of so many people who cross that border to live and work within the Lancaster County who are also, you know, have close ties to Lebanon.
Okay, great. Wendy Jarrett and Susan Eckert have questions here. I think they have their hand raised. I'll go to Susan Eckert here and I'll allow her to talk and ask a question. Susan, can you hear us? Sorry. Maybe Susan, can you hear us?
Yes, I can hear you.
Okay, Susan.
All right. So explain a little bit more about how the Partnership for Public Health works on the issue of lead.
Yeah, so I can take that one. So essentially, I think we've sort of modeled in some ways what a public health authority would do. Lead is an interesting issue because it affects so many different sectors. Obviously, the child who you want to treat and get out of the hazard home. Ultimately, we want to actually prevent it from getting into the child in the first place. It involves notifying a municipality. It involves notifying somebody that does an environmental lead risk assessment, so somebody that has to go out to the house and determine where the lead is coming from. It involves a family potentially having to relocate into a safe house while the abatement work is being done, because you don't want to be in that house when lead dust is floating around. It involves like all these different sectors, that have to come together. And we've been able to, with the Lead Coalition, actually provide a venue in which all these different folks can say, how can we figure this out in Lancaster County? We don't still have the full data set, so we can't model down to the housetop or to the street level where the lead cases are occurring. Without that, you can't really tell the municipality, go down to South Ann Street or go out to West Orange. There's this block where there seems to be a lot of lead cases. Maybe there's something going on there. Maybe there's a playground there where it used to be a factory site or something, a brownfield, and now it's a park, or it's next door to the radiator shop on, I believe that's on Charlotte Street, which is dripping lead down into a place where kids play. So without having the full ability to model, you can't leverage the good work that everybody that's come together for the Lead Coalition. And I still think we're doing good work despite not having public health authority, but you can't leverage it to the full extent possible. And I think that's really the point. Like, we have people that are willing and ready to work, that are interested, that want to know, that want to make sure that lead and the scourge of lead poisoning is gone from our community. But we're hamstrung to a certain extent by not being able to model all of it correctly.
Thank you, Susan Eckert. Susan Eckert is Hourglass board member and community leader extraordinaire. Thank you.
I would say beyond extraordinaire.
Yeah.
Yes.
And if I might add to that, we're doing like on the ground work on lead too, with testing and data analysis and support for families. We have the state's first lead safe haven for families to move into when their house is getting worked on. We're also in partnership with for a grant with F&M and working on determining how long the mitigation in a house lasts to keep kids safe, and how impacted children are once they get to public school if they've been affected by lead. And I'll just let Brian tell you about the costs of special ed for kids that have permanent damage to their brain and nervous system.
Well, all schools know that with the students that have disabilities, the costs are just, they become extravagant. We're seeing it, the 3 to 5 year olds, which we serve in the county, about 3,000 students who are identified with disabilities. I can't point to it all as a result of lead, but if it is, the majority of those students are coming to us now not just with a single disability, but with multiple disabilities. And the cost of care and preparing them to try and be ready for kindergarten, it's exorbitant. The state spends upwards of $400 million annually across the Commonwealth to serve the 50,000 students or so that are diagnosed with a disability preschool. And then if we're unable to have that disability label removed before entering the public school system, the costs just exponentially increase from there.
Wow. It's clearly the role of public health in Lancaster County is extremely important. And if folks feel that a public health department is a way forward, I think we talked about this a little bit before, but how can they support this movement and what can they do to help the process along?
You can write letters to the editor. You can contact your local public officials. You can have discussions with your neighbor and raise the awareness about public health. Public health in its purest form is about prevention. And don't we all want to prevent any kind of illness or tragedy or accident that we can in our community? So let's just get the conversation going, talk to people, discuss the pros and cons, contact your elected officials, write letters, etc. Make phone calls. Thanks.
Great. Wonderful. So we are about up with time here. Just want to thank our panelists for being here today. And it's just really good to dive into this issue and to hear your three perspectives, which are all related, but a little bit different. So thank you very much for being here.
Always a pleasure. Thanks for all that you do at the Hourglass, Jonathan. And
yes, thank you. And thanks for inviting us to this kind of a forum.
It was a pleasure.
Of course.
Have a good weekend.
All right, take care, Jeff. And we have an Hourglass Quarterly article written by Susan Baldrige here. And so that will be released. The Hourglass Quarterly will go out hopefully in a couple weeks here in November. So the article that Susan wrote is about public health in Lancaster, so be on the lookout for that. Next forum will be on December 4th, Friday, and we'll feature a conversation with the Clean Water Partners about the community-wide action plan for cleaner waterways in Lancaster County. So very much looking forward to that. And one last time, I'd like to thank our sponsors, Rogers & Associates. Thanks for all of your support in these forums. Thank you, everyone, and have a wonderful weekend.